Good evening, everyone. I'm Joshua Stanwitz, the Coalition's Director for Arizona Concerned Veterans for America. Thank you for joining us for our town hall this evening with guest Congressman Biggs and Concerned Veterans for America Executive Director Nathan Anderson. Congressman Andy Biggs is an Arizona native and currently serving his second term in the U.S. House of Representatives. Representing Arizona's 5th District, he lives in Gilbert with his wife of 38 years, Cindy. They have 6 children and 6 grandchildren. Nathan Anderson, who's joining us tonight from Minnesota, is the Executive Director for Concerned Veterans for America. He's been with CVA since 2013 and previously led CVA's nationwide grassroots initiatives. Nate is a warrant officer and a Green Beret in the U.S. Army Special Forces. Gentlemen, again, thank you for both joining us tonight. And I can always say it's a privilege to have Congressman Biggs and work alongside him. I've got to do a lot of work on his advisory panel with Lee Huff and some of his staff, including Caesar. So gentlemen, again, thank you for joining us. And I look forward to working with you tonight on this town hall.
Thanks, Josh. And thank you everybody for being here. Welcome to tonight's Concerned Veterans for America Policy Forum with Representative Andy Biggs of Arizona. I sincerely wish everybody's well tonight. I hope your families are safe, that you're healthy at this time. And I just want to acknowledge the diversity of our audience tonight before we get going. On the line, we have constituents from the state of Arizona. We also have activists from across the country, nationally. And we have some of our terrific CVA staff, our great field staff from around the country joining us. And it's a very diverse audience. So some of this conversation this evening is going to be focused toward those of you in Arizona, and some of it will be more broad in a way that applies to the larger audience. As Josh said, I'm Nate Anderson. I'm the Executive Director for Concerned Veterans for America, and I'm coming to you from my home here in Minnesota, St. Paul. And normally we would do something like this from Arizona. We would sit down face to face. We would discuss these important policy issues that veterans and their families care about. But I know that most of us are at home right now or somewhere safe as we're practicing social distancing. And of course, while we hope we can come together again soon and do this in person, I know this is an audience of veterans, of military families. And I know that we can adapt and overcome challenges like this that we're facing. If anybody can do it, we can do it. So that's why we're driving on. We're using platforms like this, like Zoom here, to continue our mission. For anybody that's unfamiliar with Concerned Veterans for America, our mission is to advocate. We advocate for policies that preserve the freedom and preserve the prosperity here at home that we and our families sacrificed for while in uniform. And I think, veterans and their families have a very unique relationship to things like freedom or prosperity. That's because we have skin in the game. We've served. And I think because of that, people listen to us when we come together and elevate our voices. CVA is building a movement. That's really what we're doing. We're giving the veteran and military communities a chance to have their voices heard. And we want to show that we can help other people rise in this country by coming together, by standing together and taking action to do that. And if anybody can do it, again, it's this group, it's veterans, and it's those that support them. So about tonight, the spread of this epidemic across the country is creating really, truly a great deal of hardship and a great deal of anxiety in America right now. In terms of people's health and their ability to access the care that they need medically, in terms of people's livelihoods, their ability to provide and put food on the table for their families, and even our ability to be with our families in person and loved ones. Every part of our society right now is dealing with this, business to education, government, and our communities also. It's causing a significant amount of hardship. And so we're here tonight to talk through some of these challenges, and particularly how it affects the veteran and military community. So with that, Representative, I just want to say thank you. We appreciate you taking the time to be here with us tonight.
Thanks, Nate. Thank you, Josh. Thanks to both of you. Thanks for inviting me. And I appreciate everyone who's on the Teletown Hall tonight. This is really important. And I hope it's something that we all walk away from saying we all got something out of it. We all learned something, and we're all a little bit better for it. I also extend Is it my turn, Josh? I don't want to get ahead of myself.
By all means,
Okay.
sir.
Okay, great. I just want to also sincerely thank all the veterans, their families, and their loved ones who've made these tremendous sacrifices. As Nate was talking about, you have skin in the game. You really care about what's going on in this country, but you really laid it on the line with your service, and we're very grateful. I am, my family, my team, my staff are as well. I would just tell you that when I think of the CVA, I am grateful to their wonderful staff. You've got great advocates in Washington, D.C., and some of the great accomplishments that my team and I have had in Washington, D.C. simply wouldn't have happened without the advocacy and assistance of the Concerned Veterans of America. So I'm grateful for your support of this organization, but support from this great team as well. And I'm looking forward to the discussion we're going to have tonight. And like I say, I hope it's meaningful. I hope it gives us all something that we can learn from and be better people and be better Americans for it. So with that, I'm going to go to you, Josh and Nate, and you guys just kind of walk me through this.
Thank you, sir. Thank you. I just want to start by asking how your constituents are doing and how you and your staff are serving them at a time like this.
So, my family, my staff, and I, we're all doing pretty well. We're all, like so many people in this country, we're teleworking. We're working from home, and as you know, I was talking to y'all before we started that my day starts earlier than it ever has before, and goes much longer because you just can't ever walk away from your computer, your cell phones, and so there's a lot of that going on. But I will tell you, my district office and Caesar in Washington, D.C., and my D.C. office, we're continuing to go. So Lee Huff, Josh mentioned Lee Huff. He is my veterans liaison in the district, and he's doing intake of cases on a daily basis. They've kind of dropped off, actually, believe it or not, in the last 2 or 3 weeks. But he's still contacting veterans every day who are dealing with maybe it's an appeal of a denial from the Veterans Administration, whatever it is. So he's dealing that. He's passing that on to me, so I can try to push the buttons in Washington, D.C., where we need local as well. And Caesar is also supporting that effort as well. So we're there, we're pushing, and we're all working, and we have these kind of conference calls on a regular too, to make sure that we're in tune with each other. But just because we're not in the office on a day, we're not working day in, day out.
There's still much to do.
Yeah, so much to do.
I'd like to hear a little bit about what people are doing to take care of their neighbors. Are there community organizations that you're aware of stepping up to take care of or assist at-risk demographics that your constituents should know about?
Yeah, I think I just want to give you a couple of examples of individuals who are really stepping up, and then I'll get into some of the organizations that are providing some of this assistance to our neighbors. But a friend of mine, he donated all of the video conferencing type of apparatus and machine and equipment to one of the local hospitals here, who have folks in there that they couldn't meet with their loved ones because there's these, the visitation rules are there. You can't. They've implemented these social distancing rules even at the hospital. So he provided all of that equipment, and that's just a really remarkable thing to do. But you're seeing stuff like that all over, whether it's food boxes that have been being put together for first responders that I've seen, and others who are shut in because of this. And so that's important. The Mesa Veterans Resource Center, which is there in Mesa, Arizona, for veterans to come in. They're continuing to provide support, and they're providing services for veterans. And if you can't get in, they're trying to provide. They do services like direct job placement, et cetera. So they're open, and they're trying to get that stuff done still, even now. We've got the United Food Bank and Paz de Cristo. Right now, they're helping alleviate hunger and folks who aren't able to get food otherwise. And so a lot of people are volunteering there. We've actually tried to volunteer in some of these groups, and they are really wary of volunteers. They're getting a lot of influx. A lot of people are trying to volunteer at different organizations, and some of them they're not really letting in because they want to make sure that you know that you're not carrying anything in as well into this situation. Mesa Industry and Defense Council, these folks are helping to retool to manufacture some of the personal protection equipment, masks, gowns, et cetera, that they need. So we're seeing that, and these are, when we start talking about this, we're talking about some major companies like Boeing, Northrop Grumman, MD Helicopters. They're all participating in some of this stuff. We have the A&M Graphics in Mesa. They're providing signs for some of these businesses that are still open, particularly restaurants. So, I mean, you're seeing this tremendous outpouring. I have to mention a couple of my favorites. One is Straight to the Plate Catering. They're preparing meals as well, but also you got to love this name, Nothing Bunt Cakes. I mean, so they're preparing meals and trying to get those out as well. So a lot of community participation.
That's great. That's terrific. You know, staying on a local note, you mentioned a little bit earlier about some of your staff. One of the things that I tell veterans pretty often, if they're having a problem or an issue with their VA services, that one of the best resources for them is the district office of their senator or of their representative. Can you tell the audience a little bit about the services that your office provides to constituents having problems navigating those federal agencies and how they can get in touch with your staff?
Yeah, that's great. We have a full staff that does constituent services. And we have, like I said, we have Lee Huff that deals specifically with veterans issues. But veterans don't have just issues with the Veterans Administration, which is where Lee and Caesar come in. They might have a Social Security problem. They might have an IRS problem. They might have an immigration problem. Well, I've got a whole team that's working on these things. And I was just talking to my Social Security as well as my IRS people, and they're getting inundated now with the small business administration issues that have happened. So, but they are there in their homes, but they're working remotely, and they're able to process calls, claims for constituents, provide information that they have. So if you have an issue, for instance, if you're a small business and you're having trouble with it, you can call my office. We can put you in touch with a hotline. If we can't help you, there are ways that I've made some specific issues trying to resolve those. So they're there. In the meantime, what we're also doing is we've reached out, and I've been briefed by the administration here. They're handling this, and we're trying to stay on top of the veterans issue as one. But let me give you my office contact. There's several ways, and it is 480-699-8239. 480-699-8239. That'll get you in. And Hannah is the one who usually answers the phone, and she will direct you to a member of the staff if they're available. If otherwise, you're going to get a call back. If you have some generic questions, I have a website that's bigs.house.gov, G-O-V. If you go there, we've got a drop down that lists everything from coronavirus to SBA, all kinds of issues related to the current epidemic out there. And so some of them from my staff, if you contact, you send an email to us, we're going to reach out and get back with you. That's what we're going to do. But that's kind of where we are, and we're staying. We're pushing. We're pushing to get these cases through, because particularly now people have a real need, and we want to be helpful.
That's terrific. I know it helps so much to have an advocate working for you, and I know that's a lot of the good work that your staff does for your constituents.
Yeah, they're great. I love them.
I want to change direction a little bit here and talk about the Department of Veterans Affairs. can you tell us a little bit about your recent communication and what that's been like with either federal or local VA facilities?
Well, so we've reached out, and sometimes the secretary in DC is a little put out with me because I can be critical and now voice it, and that's a little bit of that's gone on, but I've tried to ameliorate that as I know they're trying to work through some issues. But we've actually had a great conversation with the Phoenix VA director, Alicia Smith, and her team, I was asking, what do you need? What do you have? How are you dealing with this? Because they have so many people that they're trying to deal with. And she was very, I thought, very forthcoming. She said, look, we actually have enough PPE with the personal protection equipment. We have ventilators. We have the equipment that we need there. But one of the things that they were trying to do for social distancing is this move to telemedicine, which, by the way, you're seeing broadly throughout the society, is this move to telemedicine. And I asked her, how's that being received by some of the vets? And she said, some of the vets are really having trouble with it. And so she was trying to work their way through. But in the end, I think that's the trend overall societally is through this as well. So I would just say, look, if you're going to go to the VA, make sure you have an appointment if possible. Get there a little early because they're going to really try to socially distance folks to make sure that this thing doesn't get spread amongst our vets. We don't want it to get in amongst the vets. Many have health issues that make them particularly vulnerable to or susceptible to the coronavirus. And as you're going through and you're trying to figure out whether you should telemedicine or not, understand that that's really kind of the move afoot. And I'm going to continue to advocate for as much openness and choice for veterans as possible. I think I don't understand why we don't encourage choice. Some people want to still keep going to the VA. I'm comfortable with that. We'll keep that system there as long as we've got folks that want to use it. But we have other people who want to get to other places and for care. We want them to get to those places. But I'll just tell you, we keep advocating for constituent rights here and in DC, and we just had a resolution of one yesterday. So let us help you. Let us help you any way we can.
On telehealth, as you just mentioned, the VA has been really advertising telehealth as a service that veterans ought to use. Can you tell us just a little bit more about what that benefit can do for a patient through the VA right now? That's something 10, 20, 30 years ago, I don't think we would have quite the level of service via the networked telehealth services we have now. How can that benefit people at a time like this?
Well, in a time like this, where we are social distancing, we want to keep vulnerable populations protected as much as possible. So that means that where possible, keep them away and out of contact from people who might be carrying the virus, who are asymptomatic. And a report I heard just yesterday in a conference call is that we still haven't discovered exactly how this is being transmitted. That's why initially they said don't wear a mask because it's this stuff's going to go away quickly, and now they're saying maybe you should wear a mask in public. So the reason that you go to telehealth is it protects the vulnerable folks. Number one. Number two, in theory, and I don't know if it's going to bear it, but it will allow more people to get access to care quicker and take care of their needs. The third thing is, I think as we get used to that, this model, it's going to make it more convenient for us. I mean, and I know, Josh and Nate, the way you guys work nonstop, dawn to dusk, it's really hard to take time off to commute someplace and get checked out. But if you can get a telemedicine type of procedure, you can stay at your desk, which is where we want you. And take care of your health issue in a more convenient way. So that'd be three things. The last thing I would say, and this becomes a little bit esoteric, that we know that there's technology today where you can actually If the FDA would approve it, we would be starting to see people getting testing from their own iPhone or their own smartphone, where they could be diagnosed for some diseases and get taken care of with a medication prescription almost automatically. That's a little weird to think about for someone who, like myself, who grew up in the age of the Jetsons cartoon when that came out. This becomes really kind of odd, but we're moving in that technological way, and this is a sphere that I think is going to open up for better healthcare, more dynamic of remedies and cures going forward. And so telemedicine is maybe a stretch from that to the future, but it really is going to acclimate society to receiving care from a non-traditional caregiver model. That's, whether we like it or not, I think that's the way society's going.
Indeed, and it's really all about giving people options, right?
Yeah.
I think
Yeah.
A lot of veterans, especially in the state of Arizona, and particularly if you live in the Phoenix area, they may be familiar with the 2018 VA Mission Act and the increase in healthcare choice that it provided to veterans. I think just almost 6 years ago today, we saw what happened in Phoenix at the VA Medical Center there. And recently, the VA has begun a strategic pause. They're calling it on community care referrals or private referrals if veterans qualify for that. Are you concerned about how this might affect veterans' access to healthcare options in the community right now? I just want to talk about that healthcare choice concept.
Yeah, the healthcare choice. I mean, when I said that the secretary sometimes feels that I've agreed somehow, this is one of the areas. I'm not sure that a strategic pause here on this is really the best thing. And I think we should, particularly at this time, we should probably be looking to expand options as opposed to constraining options. And why do I say that? I say that because we have seen that there's actually medical providers who are they're not as busy as they otherwise would be because people aren't coming in. We're seeing hospitals with vacancies in beds and ICUs. We're seeing, we should be encouraging our veterans to seek the best care they can get where they want to get it. I think is a bad move to take a strategic pause. What I've experienced in my time in the government and political spheres is that you take a strategic pause, and it might be extended far beyond the original strategy for making pause. And I also am not sure that I saw the justification for taking a strategic pause here. And that's one of the things that's really bothered me about the strategic pause. And I'm advocating that they end that sooner rather than later.
Yeah, this strikes me as a time where we're cutting red tape so that people have maximum flexibility, maximum array of options at their disposal. That seems like a better course of action from a policy standpoint. And so I can tell you, Concerned Veterans for America is definitely concerned about what VA is doing here. And I think it opens up the door for potentially another situation like what happened in Phoenix in 2014, where we had a big demand, but not enough resources at VA to handle all of that. And I fear that could be what's coming here at the end of this.
Yeah, I do worry about that. I'm sure that this is justified at all, to be honest with you, by the facts on the ground, by the data that we're seeing. And I would just make a prediction, if this strategic pause extends past the end of April, then I will really not understand the justification, because we should be the bell curve of the virus, which is the ostensible reason for doing the strategic pause. The bell curve should be flattened out, and the outlier areas down at the bottom of the curve. So we'll just have to see, but I'll be vigilant. I know you all will be vigilant as well.
Absolutely. That's why that's what we do. That's what CVA advocates for. One more question on the VA front. I understand you introduced the Team Veterans Caregivers Act last week. Can you tell our audience what that bill does, why you introduced it?
Yeah, well, we're basically trying to get at three things. We want increased efficiency, transparency, and accountability in the Department of Veterans Administration, Veteran Affairs, in the Family Caregivers Program. So what we're doing is we're saying we're going to recognize all caregivers of veterans, right? So we want to recognize them as the caregivers by identifying them in the health records of the veteran. So what that will do is sometimes the caregiver has not been able to have access to records, and that's been an impediment to making sure that the vet is taken care of and that the caregiver has access to the records necessary to make wise choices and to be helpful. And we're going to require specific information from the VA. So when they notify the veterans and the caregivers regarding the determination, the clinical determination or termination of the benefits, the caregiver is going to know that as well. And sometimes the caregiver hasn't received the notification or there's been a lack of context. We're trying to get a standard of information that gets out there. So there's some communication, there's some transparency. And then I guess the third thing that I think is very important is the bill extends the Family Caregivers Program benefits 90 days when a veteran is no longer clinically eligible for the program unless there's been fraud or abuse. So the reports that we saw indicated that maybe some of the caregivers were dropped from the program without even getting an opportunity to have time to file an appeal. So we want to correct that and remedy that as well. So that's really the heart of the bill. But the bill is, the purpose is to try to make sure that the veterans can get the adequate care and be able to work with have their caregivers also be able to navigate the system and provide the assistance that vet needs. And so that's really what this is about.
Wonderful. Well, thank you. I think we're at a good midway point to transition from my questions to a couple of questions from the audience. Josh, are you still with us?
I am, gentlemen. Thank you, Congressman Biggs. Thanks, Nate. We do have a few questions here. One of the questions that we get hit with a lot through these town halls, which I think is concerning a lot of veterans, especially with cancellations occurring, is what can they do or what is happening with the mental health appointments that are being canceled? What are their options?
Well, this is a problem that we actually get. So I would say I want to immediately recommend that you contact your congressman's office. So for us, we've got Lee Huff. So if you're in Arizona's 5th Congressional District, that's where you want to make the call. Get it to Lee Huff. Lee will advocate for you to make sure that you can get something. This is a problem we have raised with the VA here locally, and I'm not satisfied that I can tell you really what your alternative is, other than we are there to advocate and rattle a cage now and then to make sure that you get those appointments. And I've been less than happy with some of the alternatives that have been proposed.
Thank you, Congressman Biggs. This one seems to be a fairly general question too, and it's what can the veterans expect for the appointments that are being currently canceled? Is there something that's been implemented in place? Have you heard anything? Is there any advice?
Again, I have not heard that there is an adequate rescheduling policy, if I can put it that way. I've not heard that there's an adequate policy in place to reschedule it. Thus, we get back, reverting back to the first answer, if we know and we have the opportunity, we can advocate for a better policy. And first of all, they shouldn't be canceling. And so many of these are, they cancel without, in real world, we would call that a postponement and a rescheduling. we're not seeing that. What we're seeing is a cancellation where it's out just in the netherworld, whether you're going to think again in a timely fashion. That is what we've been advocating for, is that if they're going to cancel mental health, because the mental health appointment actually should be one of primacy. It should take precedence over some other types of appointments. And so we're advocating for a different program to reschedule these things as quickly as possible. But I mean, seriously, Lee is great at advocacy for this. So we really want you to be calling our office and get an opportunity to help you out.
Awesome. Thank you, Congressman. We've had some questions here, and this is actually an interesting one because I know that I've heard about this from multiple veterans out here in Arizona. Have you heard anything about the prescription services for veterans, them being canceled, them not getting sent in a timely manner, et cetera, here locally?
We have not heard too much of that recently. When I first got elected, we had a number of problems like that we were able to step into. We're not getting that. Just Josh and Nate, and for the audience who's listening, this is one of the weird anomalies of the coronavirus thing. I mean, this is what I asked Lee specifically when we had our meeting yesterday, our conference call yesterday, is how is the calls coming in from the veterans? And they've slowed down really tremendously. Makes us wonder, have they lost the need, which it doesn't make sense to me, or just concerned that we're not working because of the virus or what? So we're not hearing that right now, Josh. But in my mind, that doesn't mean that's not happening now. What it means is the veterans who have that need have not been calling us, and I don't know why that is, but again, please call us. Let us help.
Thank you, Congressman. We have a few more questions here before we wrap it up, and I'll try to get these in because they're on issues that we've both kind of worked on with foreign policy and with government spending. So one of the questions we have here from Shane is how do we ensure that vast government spending packages and that the power grabs that have been going on throughout the government during this time of crisis are actually temporary, and we can tackle the debt and start to, kick it back some on the government overreach that's been going on through this outbreak?
Yeah, so thank you. And I don't ever like to be a big downer, but I'm going to be just a downer for a moment because the question lends itself to speaking the very truth about this. First of all, before we ever, even ago when the economy was rolling and we thought we had some great opportunities ahead, this year we were already $1 trillion in structural deficit. And in other words, we'd already spent $1 trillion more than we had brought in revenue. And by the way, we had brought in record revenue and we were still $1 trillion. What Congress has approved in the last 30 days is about bare minimum $2.5 trillion in spending. So there's no way to address that other than to just call it what it is. They're going to just print the money because at some point there is basically no interest here on these bonds. So I don't know who the buyer will be, so they're just going to print. So you could the addition just like roughly with coronavirus relief packages, the previous hole that we had, that's $3.5 trillion. And that does not count the cost of ongoing government program, government spending for discretionary programs from now until the end of the fiscal year, which is about $500 billion. So you're looking at a potential $4 trillion structural deficit by the end of this fiscal year. Then you add the fact that our GDP is contracting a little bit instead of having the tremendous growth we were doing before. And you now have a debt to GDP ratio that is now upside down. So by the time this is done, we'll be looking at a 108, 108% to about 110% debt to GDP ratio. That has the foreboding and ominous threat of ongoing negative economic impact. In other words, a potential severe recession. I say that because your listener, our listener, asked that very prescient question. So how do you deal with that? Just so you know, they're asking for another $250 billion relief package that did not pass out of the Senate today, but will likely pass out Monday. Nancy Pelosi is trying to plus that up with an additional $300 billion, as is Chuck Schumer. So you're looking at probably another, if that passed, another $500 billion just from that relief package. And they announced they're still working on phase 4. And I read today someone from our counterpart this also started talking about phase 5 and a phase 6 relief package, each one pushing $2 trillion. So your question is, what do we do? You got to, I mean, you have to say, let's open the markets. The first thing I would do is I would open the economy, and I would say, let's protect our most vulnerable populations, but let's open them up. So if you've got a retail store that's been closed for 3 weeks, open it up tomorrow. Open it up, and make sure that people are social distancing. Make sure you don't have too many people in there that you can't social distance. Wear the mask and gloves. Have to. Let's face the fact. As long as we aren't working as an economy and the 40-50% of the economy is shut down, you have no chance of getting out of this hole. We've got to do that. So that's the first thing I would say we've got to do. And what was the second part of that question, Josh? It seems to me there was a second part, but I got going on this part.
Oh, that's fine, Congressman Biggs. We'll hop onto a few more because we're running short on time. But going into that, we had a couple of veteran small business owners on here ask pretty much the same question, which was going in with the stimulus packages and the SBA loans that are currently going through during this crisis. What can veterans do, and how do they need to go about accessing information and getting involved with the SBA loans and the stimulus packages? I know we already had one deadline hit.
Yeah, well, here's the thing. If you are a vet and have a business, you want to get into the SBA business, you can go to you should be able to go to any community bank. There are something like 3,800 banks around the country that are doing this. Big banks, Bank of America, Wells Fargo is back up supposedly. Now they're proffering this. You can go to the SBA.gov. They will have the 2-page application, so you can fill that out and you can take it to your bank. What we found is for some this has just worked very well and smoothly, and for other people it hasn't. It's been a little bit glitchy. Secretary of the Treasury Mnuchin was on a conference call with him earlier this week, and they anticipate by the end of the week that all those glitches are going to be gone. So I mean, it is government. So I hope those glitches are gone. But if you have an issue or a problem, again, if you call my office, Christina is our staffer who's working on these SBA issues, and Jeff in DC is supporting that as well. And what we've been able to do is we have been able to actually provide hotline numbers for folks who need help with that. We've actually made calls ourselves for folks that need help with that too. So it's out there. We're happy to help. Happy to help.
Thank you, Congressman Biggs. One last question before we wrap it up and go to closing statements from you two gentlemen. When do you expect Congress to return to DC and get back to work defending all of our freedoms and everything again, sir?
I'm glad someone thinks that when Congress is in session and in DC that we are protecting freedoms. I mean, that is something that some of us would say we do enough of in DC, that's for sure. And I don't mean to be flippant about it, but I would say that sometimes I get very nervous about Congress. But I will tell you, I think that it's important for us to get back again. Like I think business should be opening up Monday. I think Congress should be back in Monday or Tuesday of next week. Why? Because a lot of folks making policy in Washington, D.C., they're in D.C., they kind of get in this bubble. And I've been out back home now for 2.5 weeks or whatever it is, on the phone every day with constituents, talking to chambers of commerce, veterans groups all over the place, getting with the feel of what's down on the ground. And I'm not sure that water's, if you ever get, this analogy, I'm not sure all that water is getting to the end of the row, the last row or two, and it has to get to DC. That's not answering the question. That's maybe too political. I think we should be there now. Nancy Pelosi has said we're going to be back on the 20th, but only if there's something for us to do. I think there will be something for us to do. I think she's working on her phase 4 plan of relief, and that means that probably the week of the 20th, which we're only supposed to be there 3 days. And then if that doesn't happen, then the following week, I would imagine we're going to be there. I have been pounding the drum. You can't pass these bills out anymore without a committee hearing. You can't pass these massive spending bills out anymore without letting us read the bills, getting analysis from people who know what this is. You can't have these unintended consequences that I'm seeing all over the place anymore. So I would anticipate by sometime the end of April, that's when I would think we'd be there. I'm planning on flying out there Monday of next week.
Outstanding. Well, thank you, Congressman Biggs. Thank you, Nate Anderson with Headquarters CVA, and I'll let both of you gentlemen close.
Sure. Thank you, Josh. Representative, I'll let you go first. In closing, what is your message tonight to veterans, to their families in a very uncertain time and very challenging time, both in your district but also broader across the country?
I think first of all, you need to know that how grateful we are. My team, my family, we are very grateful for your service and your sacrifices. And I just can't say that enough. And so the second thing I would tell you is my office, my staff, we are ready to help if you have an issue, particularly in this time. We will do all we can to help you try to navigate through these rather uncertain waters. The third thing I would say is there's probably no better situated group of people who know how to navigate rough waters and do so courageously than United States military veterans. I mean, seriously, you guys are really capable of doing this. And I guess the fourth thing that I would say is I'm optimistic. I mean, I know I painted a real bleak picture on the economy and the national debt, and we've talked a lot about issues that the government has, but I am optimistic because the American people are the best. So thank you.
Great message. That's great. And I would agree with that. And that's why we're having this forum tonight. There's still plenty that we can do. And so thank you so much. I just want to thank you for taking the time to be here with us tonight, as well as your staff for helping us set this up, all the great work that they do for the constituents that you serve. I want to give a hat tip to the Concerned Veterans for America staff who made this happen. It takes a lot of work, surprising enough, to put on something like this, and a lot of coordinations, a lot of emails and text messages. And so we have an amazing team. And so thank you, everybody who put your work into this to make it happen. And finally, I just want to thank all of you who joined us tonight. I hope that this was valuable in some way for you. I hope that you'll stay connected with us because that's what we want. Our community is navigating a challenging thing, and it's better when we do it together. So be safe, be well. Josh, I'll give it back to you for closing.
Thanks, Nate. Congressman Biggs, thank you again. And I'd like to thank, once again, everybody for joining us here tonight. For those of you that would like to get involved or follow us on social media, you can find us on Twitter at Concerned Vets. Our headquarters page, our national page, is on Facebook at Concerned Veterans for America. And then, of course, locally, AZ Concerned Veterans for America. And we'd love to hear from you. And then finally, if you'd like to get involved or do anything like that, feel free to go to our website, www.cv4a.org. Click on Take Action, enter your information, and you'll be able to join our events. You'll be able to do all kinds of activities, from contacting your local officials to your senators, and really get involved in making an impact. So for everyone that joined us tonight, again, I wanted to extend a thank you to Congressman Andy Biggs and Executive Director Nate Anderson. You folks have a wonderful evening, and we look forward to hearing from you. Good night.